Today I'm releasing new data that shows just how deep the crisis in our ambulance system is under the UCP. Albertans have a right to expect that when they are sick or injured or in distress that there are paramedics available to come to their aid. But what we can see today is that increasingly under this UCP government, that is sadly not the case. A red alert is activated when there are no ambulances available. And the data we're releasing today shows an explosive growth in both the number and the total duration of red alerts in Edmonton over the past 3 years. In May of 2019, there were 13 red alerts in Edmonton for a total of about 20 minutes. In May of this year, there were 859 red alerts for a total of 24 hours and 42 minutes. And that's not even the worst month this year. In January, there were 1,233 red alerts for a total of 39 hours and 41 minutes. We've seen horrible incidents in Calgary of critically injured Albertans waiting and waiting for an ambulance to arrive. This is a crisis. Paramedics have been clear about what needs to happen. We need more paramedics, and we need to take better care of the ones we already have. This government needs to commit to getting EMS crews off shift on time. The additional hours that paramedics spend stuck at overwhelmed hospitals, including here at the Royal Alex, is one of the main drivers of burnout and turnover in EMS. Second, the government needs to offer every paramedic a full-time permanent contract with benefits, instead of the 89-day temporary contracts that make up about 40% of the EMS workforce today. Lastly, the government needs to urgently expand harm reduction services that save lives and reduce the incredible burden that the drug poisoning crisis has put on paramedics and emergency room workers like the ones here at the Royal Alex Hospital. As I said, we simply need more paramedics on the ground. The system has been run far too lean for far too long. We've expected far too much of the paramedics that we had in the system and have pushed them too far. And now we're starting to see the effects of that. When we add in, of course, then the impacts of the mismanagement and neglect we have seen from this UCP government throughout this healthcare crisis, the COVID-19 pandemic, that brings us to the situation we find ourselves in today.